What is ketamine and can it help you? Ketamine is an anesthesia and pain medicine developed over 40 years ago that was found unexpectedly to quickly, effectively, and safely lift people out of their depression who had not responded or in some cases not tolerated traditional antidepressants. It also stopped people from having suicidal thoughts, sometimes after just 1 or 2 treatments. This is so important since antidepressants can take 4 to 6 weeks to work, if they work at all. The mechanism of action is not well understood, but we believe it works on a different chemical in the brain or neurotransmitter from other antidepressants called glutamate. It also helps the brain rewire itself and make new connections that can positively impact mood, anxiety, and other brain functions. Ketamine can also cause a dissociative or disconnected feeling in people while taking the medicine, which often can have a transformative and therapeutic psychological benefit. The drug is not FDA approved for depression since it's off patent or generic. That means it's very little incentive for pharmaceutical companies to pursue such an indication, which can be a very costly and time-intensive process. So don't expect your insurance company to pay for it. The most studied and likely most effective way to take ketamine is through an IV or in the vein, typically over 40 minutes. But some doctors will give through the nose, orally, or even as a shot through the muscle or the skin. Though some people will feel better after 1 treatment, most people will need a series of treatments, usually a minimum of 6. Often people need some kind of booster or maintenance treatments over time to keep the benefits, since it can wear off after a week or more. How frequently you may need to get retreated varies from person to person. Most people will stay on their antidepressant medicine, but some do well with ketamine alone, or are able to greatly reduce the amount of medicine that they're taking. Spravato, or S-ketamine, which is given through the nose, is a recently approved tweaked version of ketamine. But we don't know if it's better, same, or not as good as ketamine since it's so new. Pharmaceutical companies are developing new medications for depression that work similar to ketamine, that they hope will be even safer and better, but it's going to be a while before those come out. While ketamine has been a game-changing, life-saving treatment for many, there may be physical or mental health reasons why ketamine may not be a good treatment for you. To see if ketamine is right for you, have an evaluation by a trained mental health care professional knowledgeable about this treatment, and make sure that where you get ketamine from is a place that has experience not only in giving ketamine, but also has specialized training and expertise in treating mental health conditions.